We're just trying to figure out based on the movie that we watched, what our names were going to be. So I chose Lady Catamenia, and then Maureen hasn't decided which one she wanted yet, but I think I decided what I wanted to call her.
Dysmenorrhea. Lady
Dysmenorrhea.
I want to thank all the subcommittee leads and all the subcommittees who have done just an amazing amount of work. And we asked them to kind of see where their projects were aligning with our goals, just to sort of put it in alignment. And they all squarely fit into like all the categories. So no project is any better than any other project. They're all meeting the land goals. And I think we should all be really proud of ourselves. Any comments or questions after that, the presentation?
Any ideas? You don't have to answer now. We just figured before we go to the next session, since this is fresh in our minds. No? Well, we're getting towards the end of the day. We were thinking of doing something fun. And since this is a game that I had never played before, I'm going to let Maureen take it away.
Okay, how many have read a bedtime story to a 7-year-old?
Obviously.
Okay, how many people have read a Choose Your Own Adventure book? How many read them when they were kids? Okay, anybody have a favorite one they want to share? My favorite is Adventures of the Yeti. Anybody else? Okay, we have made up Adventures in Iron. And this is a tool that Angela Wyand and I took to the NASPEG meeting last spring to help prompt a discussion among adolescent medicine and adolescent gynecologists about what are their real questions in management of iron deficiency and heavy menstrual bleeding. And I adapted it a little bit for today to pretend like you are not hematologists and gynecologists maybe, but to pretend like you are a primary care provider. Because I think this is a model and an example of like how we can do some fun education with our primary care providers. I've heard a lot today about how we're getting, I don't know about you, but we're having like the zombie apocalypse of heavy menstrual bleeding that has no evaluation and no management before it gets to us. And I see a lot of heads nodding. Yeah, so I think that one of the goals that we've been mentioning is to enhance our education to our primary care referring providers. And so thinking about fun ways to do that, this is only one idea. I did use ChatGPT a lot to help create this model because it is very difficult to write a Choose Your Own Adventure, despite them being very short books. So please forgive me if we go off the rails, but we're gonna read a Choose Your Own Adventure together, and as we read it, I want you to maybe take notes and think about what are some prompting questions that you as a primary care provider might have, like, for example, like, what's the dose of that? When do I start it? When do I not start it? What's my decision making like in this situation? Just try to put yourself in the shoes of that person and think about what kind of things that you should be putting into your education that they might have questions about. And I'm sure we'll come up with other ones. And this won't be a like complete story, but we're gonna start you off, Jen and I. Yay. Lady Catamenia. And then could we have people who have a readers in the audience? Can you hold up your cards? I think we have everybody here, so hopefully we'll get through this. Okay, so, you are a healthcare provider seeing an adolescent for a 20-minute appointment. You thought it was a follow-up about her period, but it ended up being a request for a sports physical. Not what you usually do, but she really needs the form signed. You look up what is required, and it seems pretty straightforward. You're looking forward to chatting with Kara since you met her about 8 months ago for a healthy adolescent visit. You chat with Kara about how things have been going for her recently. Kara just turned 13. She's starting 8th grade soon. She's been playing soccer since she was 4, and she's been on a year-round club team since last year in 6th grade. For her birthday, Kara and a few friends from the same soccer team went to see Wicked in the theater. Kara is a healthy kid. She's vaccinated, has had annual well child checks without any issues. She's doing well academically and socially, though middle school's been tough. Kara and her mom filled out the health history form that you had downloaded from the AAP website. You review the form and you perform a careful cardiac exam. On the health history form, Kara indicated that she sometimes feels short of breath during a game when she plays midfield, and sometimes her chest feels tight after running. Nothing else comes up, and you sign off on the form and wish Kara good luck with the fall season. As you are saying goodbye, Mom asks whether any other tests are needed and when the next follow-up should be scheduled. If you decide that it would be a good idea to check a set of routine screening labs, turn to page 4. If you decide that an ECG would be a good idea to make sure you don't miss an arrhythmia, turn to page 11. Jen, what do you want to do?
So she has, again, I never fill these forms out. But I don't know, she has chest pain, she's short of breath. I would do an EKG because that's gonna kill her first before the anemia. So I would do an EKG.
All right, who has number 11? Okay, so when you open it up, just make sure you open up the whole thing so you see that it's number 11.
Hold on, I'm gonna do this so you can read it.
Oh. So since there's double-sided, just make sure you read the right one.
Oh, you're gonna read that.
Kara gets an ECG, which is normal. About a year later, you get a message that she had a hospital admission for anemia.
Well, I just killed her.
You guys want to back up and go back?
I mean, Avi.
All right, let's get a set of routine screening labs. Who has page 4?
You're reading this one.
Well, I got it right. So with your hand on the doorknob, you turn around and say, yes, Kara is due to have some blood screening tests done. You turn to the CDC Bright Futures chart on the wall and verify that lipids and CBC are recommended. Kara looks horrified. She has never had her blood drawn before, and getting up early on the weekend without eating breakfast for a fasting test totally won't work. You hesitate since they don't have any family history of cholesterol problems. You decide to skip the fasting for now and order a CBC with non-fasting lipids. Okay. If you send Kara to the lab across the street to get the lab drawn, please turn to page 5. If you have your brand new medical assistant do the blood draw, turn to page 9.
All right, you get to pick.
Across the street. Across the street.
All right, labs
Yeah.
across the street. Okay, that's number 5, right? Yeah. Who has number 5? Lauren.
Oh, thanks. It says 5 right there. Yeah. Okay. You send Kara and her mom to the lab across the street for a blood draw. They either never made it there or the lab was closed already. By the time you realize it was never done, it is already over a month later and soccer season is almost finished. If you call and check in on symptoms and remind them to go to the lab, please turn to page 6. If you send an email or MyChart message reminding them to schedule a health maintenance visit, please turn to page 3. I think we'll turn to page 6.
Who has number 6?
Call to remind about labs.
Yep.
You call Kara and her mom to remind them to get labs done. Kara is at practice. Her mom says things are going great. Kara is super busy with school and soccer, traveling a lot, and tired all the time. Mom is worried about all the junk food she's eating on the road. They'll try to go to the lab this upcoming weekend. After a few more months, you still haven't seen labs back, but you receive a message from Kara's mom. Kara continues to be tired and is also having more trouble sleeping at night. She has recently been feeling really anxious with episodes of heart racing. She is glad the soccer team has their midwinter break right now because she wouldn't be able to play. Even with school being out, she isn't able to get enough rest due to the stress. She hasn't fallen behind in any classes yet, at least. If you recommend a visit with a therapist, please turn to page 8. If you recommend a clinic visit as soon as possible, please continue on to page 7. I'll go to page 7.
Page 7.
Right, there's just the uncrossed out. Got it, thank you. All right, 7, return clinic visit. Kara returns to the office with her mom. She doesn't totally look like herself. The energetic soccer player is gone. In her place is a pale, sad-looking teen wearing pajama pants and slippers. Wah, wah. Sorry. Soccer season ended, but it was tough, and Kara isn't sure if she's going to try out again next year. You check on her medications and symptoms. She is taking a chewable vitamin with iron most days. She reports needing to stay home from school a lot. You ask her why she has been staying home from school so much, and she shrugs and says, "No one cares about attendance anyways." If you place a consult to the clinic social worker to find out why she is staying home from school so much, turn to page 15. If you place a consult to gynecology, turn to page 2. I don't like either. I mean, I love social workers, but can I ask more questions? No. All right, I'm going to go with 15 because I'm not going to send her to Maureen without questions. Sorry.
All right, who has 15?
Okay. So you place a referral to the social worker who was in clinic that day, and she was able to meet with Kara immediately following your visit. She fills you in after clinic that Kara has been really suffering from long, heavy periods, and it's not the heaviness that bothers her, it's that she's so tired. She feels like she can't stay awake in the afternoon classes without a nap. She's also needing to miss a lot of class just to get to the bathroom between every class to change her pad so it doesn't overflow. This is an amazing social worker. She already helped the family navigate a 504 plan, has a form letter for the school nurse. She also showed Kara a website with some options for menstrual management. Kara doesn't mind having periods, she just wants them to be lighter. She may be interested in TXA and wants you to call her about it. You call Kara that same evening after clinic and take a full menstrual and bleeding history. You realize that Kara has also been having worsening bloody noses ever since her period started. You discuss her preference and end up prescribing TXA and make a plan for 3-month follow-up with labs. End.
Well done. There are other pathways that lead us to more questions. So take a second and see if there's any questions that have come up that you think a primary care provider might have. And then I think we could go back to what we do after the lab draw. So at the end, I think number 5 was lab draw. Was that you, Nancy? Oh, Lauren, do you want to read the options after yours? We picked 6, I think. What was option 3?
If you send an email or my chart message reminding them to schedule a health maintenance visit, please turn to page 3.
Okay, anybody have number 3? Okay.
Sorry, I gotta put my readers on.
Yeah.
Even though Kara's annual wellness check has been rescheduled twice, bringing it to 6 months later, she is happy to see you. You ask Kara all the usual questions, but this year you focus a little more on asking her about screening time. No problems there. She doesn't even have a phone yet. You ask about mood and conduct, your usual questionnaires, including PHQ-9 and ASQ. You then move on to ask her about her period. You ask when her period started and how many days it lasted, and whether it was painful. Kara tells you it lasted about a week and has been coming every month for about a year. And it's annoying, but not too bad. You tell her she should expect to take, you tell her she should expect to take care of herself a little more during her period since they can be draining. Well, I've been really tired a lot, but that started before the period, said Kara. and added by her mom, she's only really about to have 12 periods so far, but there's anything else she should be looking into for how tired Kara is? I know she's doing a lot, but she spends the whole day on weekend napping and didn't even want to hang out with her friends last week.
Do you have a couple options at the bottom there?
Sorry, yes, I do. If you recommend getting a blood draw for labs for the 15th time, turn to page 17. If you recommend taking Flintstone multivitamin, turn to page 16. I picked 17.
All right, 17.
I know. There you go.
All right. Your clinic assistant walks Kara across the street to the lab. Ferritin is 16 and hemoglobin is 12. You ask Kara to complete a menstrual bleeding diary and provide some guidance on how much menstrual bleeding is too much. You encourage oral iron repletion and follow up for repeat labs in 3 months. And that's the end.
So I'm hearing a good clinical question here. Is that 3 months? Is that the right follow-up timing? Great. Well, I think we have like one more track if you guys are still up for a little bit more. We have some more people reading. We're going to find out a lot more about Kara. Okay. Whoever has number 4. Which path did we not follow?
If you have your brand new medical assistant do the blood draw, turn to page 9.
Oh, brand new medical assistant on
Yes.
page 9.
Who has 9?
Who has 9? All right. We have a microphone.
I took it. I missed. Don't choke. Don't choke.
Okay. Labs are drawn in clinic. The labs are drawn in clinic, and overall, Kara did okay. They were in the room for an extra 30 minutes after she got queasy, but the blood is off to the lab. You let them know they will hear the results in a couple of days. The next day, you open your inbox, and the results are there. Mostly normal, but a few red marks. The hemoglobin is normal at 11.5. WBC and platelets are normal. The red marks are mostly on the other components like MCV of 76%. Given these results, you send an electronic message to Kara's mom along with a follow-up plan. If you send a message that says, "Hi Kara, your blood tests are normal, keep taking vitamins, and I'll see you in about 6 months," please turn to page 10. If you send a message that says, "Hi Kara, your blood tests show some issues that need further testing," please turn to page 12. I'd go at 12.
Voting for 12. Okay. Who has page 12?
Kara is able to get a virtual appointment with you the following week. You ask her to go to the lab before the visit, which she was able to do. You review the results, and her hemoglobin is 11.3 and ferritin is 12. You chat with Kara about her soccer practice while you wait for her dad to join. Then you review her blood tests that show iron deficiency anemia. You review the goal levels for ferritin that includes iron sufficiency and explain how long replacement takes and how you will know that there is adequate treatment. You then move on to ask some questions about her period and her bleeding history and family history. You determine that she has moderately heavy periods and hasn't been taking any oral iron, though she does eat meat and sometimes takes chewable vitamins. You start to discuss iron vitamins, but she tells you that she is never going to be able to remember to take pills every day. What should you do next? If you decide that Kara should have an IV iron infusion, please turn to slide 14. If you continue to encourage Kara to take oral iron at least every couple days when she's on her period, please turn to slide 13. Let's go 14.
14.
That was a good primary care question in there, right? About microcytosis without anemia. Like, why
Yes.
do I need to worry about microcytosis without anemia?
Love it.
Let's see, I think I have a. Kara goes to get the IV iron. She missed a day of school and it kind of hurt, but the nurses at the infusion center were nice. She watched Wicked again, which reminded her she should plan a birthday get-together pretty soon. End.
Aww.
That was the end.
Oh my gosh. Okay, we have a few others out there who we haven't heard the ends from yet, if you guys are interested. Okay, 16. 16 came after 3, and 3 was the health maintenance visit, whether you should get labs or start vitamins.
16, chewable vitamins. You advise a couple of brands of chewable vitamins with iron. About a year later, you get a message that she had a hospital admission for anemia. Can we do the one with the awesome social worker again? That was way better.
All right, I think we have number 8 out there still. This is the therapist visit.
Visit with a therapist. You had recommended a visit with a therapist for school anxiety. Unfortunately, before Kara was able to meet with them, she fainted in the shower and had to go to the ER by ambulance.
Okay, we have number 2, gynecology referral. It's like I planted these or something.
Gynecology referral. Since Kara isn't probably going to want to talk to you about periods, and that's what you suspect is the issue, you place a consult to your gynecology colleague. Unfortunately, you didn't realize that the gynecologist waitlist is so long, and since you didn't include any history or very many labs in your referral documentation to help with triage, they are not able to get her into clinic until several months from now. Oh, wow. And sad.
We're not all bad, but we do have long wait lists. Okay, last one, number 13. Number 13 is oral iron repletion.
After discussion, Kara decides to really try with oral iron. She would like to give it 3 months to see if it'll work. If it doesn't, she will schedule the IV iron. You review dosing and formulations, including timing of taking it compared to meals and other vitamins. After doing this for 4 weeks, you recheck the ferritin and it's increased a little bit by 4 points. Kara is not feeling any better, but by Kara is not feeling any better, but by 3 months the ferritin is 20, and she's no longer having leg cramps. She's getting better at remembering to take it, and she found a liquid version that she actually likes. You discuss a follow-up plan by rechecking every 6 months to make sure that it's stabilized and it's greater than 30. You also bring up the option of using medications to reduce her menstrual losses. After discussion, she decides to start combined transdermal estrogen, progestin cyclically. End.
I like that end. That's a good end.
Thank you, everybody. Oh my gosh, we didn't get stuck in a loophole.
No, we didn't. All because I chose the EKG first. So we thought that this was, well, Maureen thought that this was a fun way to sort of educate our colleagues, or maybe just bring up ideas, bring up any kind of, we don't know what we don't know, right? So it's not until you have these conversations that we figure out that our primary care colleagues may have some deficits and things that are very much second nature to us, but are not to them. So I think this is a fun thing to do with residents or fellows. There's a lot of education days, or when we're asked to give lectures to residents. Instead of giving a lecture, maybe start the lecture like this, right? With this sort of game and see where they take it. So I think that would be fun.
Yeah, did anybody come up with any new teaching concepts that they hadn't really been incorporating into their teaching quite yet, or hadn't really thought about?
I feel like a lot of our patients come in and have such a deficit as to how long a period is supposed to be, like, because, you know, they just, no one teaches them that, I feel like, anymore. And I don't know if anyone has gone out into the community. Like when I was in grad school, we did this for nutrition, but has anyone gone out to the community, to schools, to the school nurses and stuff, and asked to, like, have discussions with those students to, like, give them some more education about their, apparently one, about their menstrual cycles and just about menstruation. Because I feel like, you know, parents give you, like, an abridged version because they don't really want to have that conversation, right? And so I just didn't know if that was something that people are doing, or...
Mira's done that. Do you want to comment, Mira?
That's something that we're trying to do in California, is work with the Hemophilia Patient Foundation to get information out to school nurses on not only just like how to manage bleeding issues, but also signs and symptoms of a bleeding disorder, because many present with heavy menstrual bleeding. And so that's one avenue that we're trying to get more education out there. And we've done some just in our local, like in the Oakland School District, we've had sessions with the school nurses. So definitely partnering with the School Nurse Association in your area is a good idea. Yeah.
Yep. So we started this effort about 5-6 years ago now with the Detroit Public Schools to see so that we can provide education to, the intention was really because we started seeing a lot more girls come to the ER with hemoglobins of 4 and 5. And my thought was that we should be able to intervene before they come to the ER with a hemoglobin of 4 and 5, instead of just taking care of them after they come with the hemoglobin of 4 and 5. So the thought was that the best way to do this will be to reach them at school, because that's where you're going to find everyone. And so we do 2 sessions per year where we go in. We are currently doing only high school. The intention is to start in the middle school because that's when periods start nowadays. And so, but right now we're doing high school, 9th through 12th grade. We do 2 sessions a year. We go in, before we start the student education, we actually do education for the school faculty, because they're going to reach out to those teachers and nurses first before they actually come to us. And those people need to understand and recognize the problem so that they can refer them to the right place. So we do like a basic education of what's normal, what's not, what are the signs and symptoms of anemia. My nurse, Charity here, does all of the product things, and my NP, Cindy, also does the medical portion of it when I'm not available. And then we have our social worker talk about resources for period poverty and period products as such. There is actually a toolkit on the FWGBD website which has all of the information that we provide to the schools. So if anybody's interested, that information already exists. And so there's simple, easy to understand information that you can provide to your patients. And if you're doing it at a school, you can also use it at the school level. Hopefully, we are looking to expand it to other school districts right now. And my only issue has been trying to find a way to publish what we've done. The HIPAA rules are terrible with the school district, and hopefully it'll work out. But yes, it can be done, and I think that is the way we should go.
While you pass that down, is there a way that we can do this virtually? There was a time myself and Katie McGuinn, we had like a horse and pony show where we went to all different types of payers and we taught them about hemophilia. And we did this for a few years, and it was very well received in the hopes that it would help with prior authorizations and things like that for that population. And it was very word of mouth. They would hear, then they would invite us. And we ended up doing something like 30 lectures over, a span of like 3 or 4 years. So I just wonder if maybe the land can put together sort of like a lecture series that then we can say to APON, or we can say to whatever society or organization of school nurses, you want CME, why don't you do this, right? The issue with that is that we're not going to be there in person to be able to answer questions, but even if we just sort of lay that little egg and then it'll blossom from there, it's something that we can do. Education subcommittee can.
We started at COVID, so we had to do it virtually. We didn't have a choice. The issue was that only 10 kids showed up. They had to log in. We literally would have 8 or 10 kids at the most that would show up, and this was for the entire 11th grade and 12th grade together. And so that was one. We did do the virtual teaching for the school staff, and that was great. We had 65 people online listening to what we had to say to them. But then when the kids showed up, it was like 8 or 10. Yeah. And when we looked at like a pre and post survey that we did, just to see if they retained anything that we had provided, first of all, they didn't take the test half the time, either pre or post. So it was really hard to assess what the efficacy was. Right. So there are some challenges. I'm not saying it cannot be done, but I guess there'll be some challenges if we have to do it virtually. If it's mandated by the school, I feel it would be better, because this was a choice. The kids had the option of logging in. They didn't, it was not mandatory to log in. Yeah.
because they can't do that, I guess, because this is not a required curriculum. And so they had to give them the option. And so when you give people the option, nobody wants to wake up at 9 in the morning and log into a class like this, I guess. So that was the challenge. That was what we faced in terms of challenges.
Thanks for the background. And we have somebody in the back.
It's me. So the other thing I think for people to know about is the Period Education Project, which is the nonprofit arm of Girlology. So it is menstrual education that is led by medical students. So if you have a medical school that you work with and you have medical students who are interested, they can reach out to the Period Education Project, and they need a physician mentor, but then they get taught the educational content, and then they work with youth serving organizations in the community. So like, for example, like Girls Inc. or an after-school program where then the medical students go in and they teach the period education to that youth organization. And so that, and their website is very robust. So if you work with a med school or you want to be like a physician liaison to help med students then learn how to teach this information to kids, that's an option as well. Period Education Project.
Great. Other comment in the back?
Yeah, Nevada, when I was out there, Becky Berkowitz, myself, and our nurse practitioner at the time would go out to the different school districts. Clark County is the 4th largest school district, so we had a couple hundred nurses that would have to come in for educational purposes each year in August prior to the start of the school year. And we would give a 1-hour talk on bleeding, menstruation, 1-hour talk on patients with cancer coming back to school, things along those lines. And we got through fairly well because September, October, we got on average 30 or 40 referrals directly from the school nurses.
Great. Any other comments on especially educating educators or educating primary providers? Jenna?
I think this sort of is in that vein, but I guess as we were going through all of this, it really didn't seem too shocking to me that a primary care physician would have a really long differential for fatigue, whereas most of the people in this room would